Hello, class. My name is LeJarvis Lewis, and I will be providing a PowerPoint presentation on abnormal uterine bleeding. The table of contents consists of the overview, pathophysiology of abnormal uterine bleeding, the epidemiology and risk factors, clinical assessment findings for this condition, as well as the diagnostic tests for this condition. And then we will discuss three different differential diagnosis for abnormal uterine bleeding, as well as the clinical assessment findings for each of the diagnoses. We'll also talk about prevention and treatment, family education, and best practices. That's a general overview in pathophysiology. Abnormal uterine bleeding is just a broad term for irregularities in the menstrual cycle. It can be vaginal or dysfunctional bleeding, heavy bleeding or unusual bleeding from the uterus itself. It can occur at any point or any time during the menstrual cycle. It can last 7 days. It can last a month. It just depends. Um, and it's typically caused from the derangement in the structure of the uterus, clotting pathways, or a disruption of the hypothalamic pituitary ovarian axis. And all it is just talking about the hypothalamus, pituitary gland, and the gonadal glands. All three of those together form this axis that has specific functions for certain hormones in the female body. One of those major hormones is progesterone. And every month, when a female has her cycle, towards the end of the cycle, what is it, 3 day, 5 day, or 7 day cycle for the women? The closer it gets to the end of that cycle, the progesterone level starts to drop. This causes the body to release certain enzymes, and those enzymes actually starts to break down a part of the uterus known as the endometrium. And when that happens, you'll start seeing sloughing of the uterus, and this is where the bleeding itself typically starts. The prevalence of this condition is between 3 and 30%. Some of the biggest risk factors is females over the age of 35, women that are typically overweight. Actually, high blood pressure can be a risk factor, and women that are right at their perimenopausal state as well. Clinical assessment findings with abnormal uterine bleeding. Um, some women may have pain. This really depends on what is causing this bleeding. They can have abdominal pain. It can be upper or lower. They can have pain in the pelvic region. Some, depending on when they finally come to the doctor, checking the vital signs, you may see an abnormally high heart rate, a low blood pressure. Um, some women may have, we'll talk about a routine in their lifestyle changes. That saturate multiple pads a day. They're having so much discomfort at certain events, and it's altering their life. Some may report passing blood clots or seeing blood clots on the pad itself. Um, or they may just say they just been having a heavy vaginal bleeding. Their cycle was supposed to go off 2 days ago, and they're still bleeding. This is typically diagnosed based on multiple tests. Of course, the interview process is one of the most important, um, because everyone is not fond of disclosing something of this magnitude because most women may find it embarrassing. So when you're doing this history, you need to make sure it's in private. You may have to ask family members, whether it's a spouse or a child, to step out of the room so the females can be truthful about what has been going on, how long it's been going on, and this will help in determining what to do next or which direction to go in terms of a diagnosis. The physical assessment is very important to help diagnose this condition as well. Um, we talked about the abdominal pain, so doing a good, thorough abdominal exam, find out the location, what elicits the pain, what makes the pain go away, bowel sounds, that type of thing. Vital signs, the blood pressure, like we talked about, like I mentioned earlier, along with the heart rate, you see a fluctuation in that, but that'll be later, depending on how long the bleeding itself has been going on. Early, you may not see issues with blood pressure or heart rate because the body may be at that compensating state. Um, so you may not see an abnormal blood pressure or heart rate. Um, and then also doing the pelvic exam. And on this pelvic exam, you can actually observe the amount of bleeding. Is it heavy? And while you're there, you can obtain do the pap smear and obtain a sample, get a endometrial biopsy as well, and also do some whether the patient said they are or not sexually active or only with one partner. It's still important to do a screening for any type of STI because this can cause abnormal bleeding as well. Differential diagnosis number one is conditions that are related to the reproductive tract pathology, such as uterine sarcoma, endometrial cancer, as well as ovarian neoplasms. And clinically, you'll see some of the same symptoms, especially when we're talking about cancer in general and dealing with the female reproductive organs. They can have the classic typical abdominal pain. It may be nagging, it may be severe, it may be mild. Some women may be older, come in complaining of just loss of appetite. They just don't want to eat. Um, Feeling bloated all the time, and it's not time for their cycle, or it is their cycle, but they just feel more full and bloated than normal. Um, Bladder issues is a real alarming one because some women, 40 years old, may start experiencing a lot of urinary frequency, and this can be bad because, sorry, and this could be bad because if it is, let's say, the bleeding is due from some type of cancer, then once that cancer starts to spread and advance, it start causing an issue with the bladder, and this female is not really able to control her bladder like she needs to. So urinary frequency is something to talk about with these females. And then some, just like I said, just have irregular bleeding. It's not time for their cycle, but they still bleed, or the cycle is on, but they bleed more than normal. So a history is very, very, very important. Differential diagnosis number two is dealing with women in terms of pregnancy. And that would be ectopic pregnancy, placenta previa, spontaneous abortion. All three of these is something to consider as well. And clinical signs and symptoms, they will have typical pelvic pain. They can have abdominal pain. Um, they can have vaginal bleeding. This can be painful. This can be non-painful. They may mention blood clots or larger blood clots than normal. They may feel bloated as well. They may complain of a little lightheadedness or just a severe pain in just the stomach. It may not be lower pelvic. It may just be the general stomach area. So it's important to get a good history. Differential diagnosis number three is bleeding diathesis. This can be a vitamin K deficiency, thrombocytopenia, and an important one is anticoagulant therapy. A female that has a history of AFib and she's on Coumadin. This is something important to know because the bleeding could just be a direct correlation with the anticoagulant therapy. You need to adjust it based on whatever her PT INR level is. Clinical assessment of diagnosis number three, they may have pale skin. They may complain of dizziness. They may be hypotensive on assessment, and they complain of heavy bleeding during the period. The dizziness, it may be prevalent, it may not be in certain women, as well as the hypotension we talked about earlier. This really depends. This is really an individual basis because some women may bleed heavier, some may bleed not as long. Um, so depending on how long they've been bleeding and the severity of their bleeding will kind of determine whether or not you see the hypotension, the dizziness, or even the pale skin. Prevention and treatment. Weight control is important um, because, as we mentioned earlier, obesity is a problem directly related to abnormal uterine bleeding. So, getting their weight under control is important. Um, Birth control for some that are younger, um, which is pretty much regulating the body with hormones to control the bleeding. Stress management. Stress can cause women to have abnormal bleeding, start the cycles early, what have you. So controlling that is important. Um, and just a wellness exam. Um, Abnormal uterine bleeding from an aggressive cancer, just your wellness exam yearly, getting your physical along with your PAP, and if there's any abnormal cells, you get them sent off to cytology. They to confirm or deny cancer. If it is, we can address it early before the cancer gets so advanced that it starts to cause bleeding. Treatment for abnormal uterine bleeding is really related to the cause of it. But just in general, progesterone 5 milligrams POTID um, can help control bleeding if it's a hormone related issue. Non-pharmacological treatment options, dietary changes. This goes along with sports and lifestyle changes because this will help manage the weight to keep the weight down. Also, surgery is an option, but once again, surgery to treat this condition is going to depend on whether or not the condition is can be addressed surgically. Some of it may just be medicine. Some of it may just be the lifestyle modifications, getting rid of the everyday stress in your life, eating healthier, what have you. Family education and best practices support healthy, active lifestyle with these individuals. I think the second one is probably one of the most important ones because everything that we discuss stems from having this open discussion in private, um, and pretty much having to beat information out of women if they are not willing to disclose it. And it's just going to depend on you as a provider and how you ask these questions to get the most information out of them. Because women are embarrassed, some are, I'm sure, when it comes to events and they're constantly bleeding, they're having to constantly change their pads. There's so much discomfort. They try to um, enjoy time with their mate, but they can't because of the pain. Um, Having just safe, intimate relationships and not multiple sex partners, this would decrease the possibility of developing uh, a STI. Um, and it's important to tell these women to come in and get your exams. You don't have to wait until a problem exists before you go get treated or get tested for something. So just stand on top of that and really help. Um, Also discuss with the women that surgery are options, but when those surgical options are discussed, also discuss with her the lifestyle changes that's going to come with that. Let's say a hysterectomy. You just explain to her that her normal hormone level is not going to be the same. She have to be on some kind of medicine the rest of her life. You talk her sex drive may not be the same. So it's a lot to consider when you're talking about surgery. And to the right, I have my three discussion questions. And here are my references. Thank you.